Okay, so good afternoon, everyone. And so my name is Dr. Saqib Shahab. I'm the Chief Medical Health Officer, and we did commit to providing regular updates on new cases and other areas of interest. And I did also want to take this opportunity to have some further discussions on what's been happening and how things are going. So maybe I'll just give a quick update on our cases and testing numbers, and then open it up for a bit of a discussion. So as of today, we are reporting 8 cases. 2 of them from the Saskatoon area. They were the earlier ones. They are confirmed. And then of the 6 who are presumptive but likely will be confirmed, 1 we had reported earlier from the north. And then we have 5 cases now from the Regina area. And 1 was, out of those 5, 2 were individuals who had traveled from the U.S. 1 of those 2 is actually hospitalized due to non-COVID related issues. And of the other 3 from the Regina area, there was 1 case who had attended a dental conference in Vancouver, and then there was a secondary household case. And then we have a second case, the 5th case in Regina, and our 8th case, who also had attended the dental conference in Vancouver and now has symptoms. And apart from the 1 person who's hospitalized, all the rest of the cases are actually doing well, and we expect them to make a full recovery within a week or 2. There's good evidence now that people who have mild infection clear the virus within 10 to 14 days and don't even require retesting once the symptoms are gone. They just, public health just does a symptom review, and then they're free to continue their work. In terms of testing numbers, obviously our testing numbers are going up. We are at 880 tests ordered. Obviously some tests can be done more than once in a patient, so this doesn't mean how many people, but it's a rough estimate of how many people have been tested. 191 of these tests were ordered from the north, 284 from the Saskatoon area, and 405 from south, including Regina. So testing numbers are, fairly good, and they're throughout the province. As with 8 confirmed, 6 presumptive, and 2 confirmed, the rest of the tests are either negative or some are just pending. About 24 are pending. So that's just something that happens as a routine. Nationally, of course, we all know that case numbers have gone up significantly in some parts of Canada where they've had a longer period of time with initially travel-related cases, but now some concern with community transmission. And linked to that, additional measures have been announced in those provinces. It seems, I didn't do a province check-in, but on Saturday we were discussing that many provinces actually in the western part of Canada were having March break, and some were just having their 1 to 2 weeks March break, some were just extending them. But I think, Saskatchewan was the only province which didn't have a March break. We were planning a break in April. But right now it seems that most, if not all, provinces in Canada have schools dismissed. Obviously, we are having discussions on what further steps we need to take around limiting community transmission. But as you all know, many businesses are kind of slowing down activity. Many people are very conscious now when they're going out, if they are shopping or otherwise going out, about social distancing. So I think as a province, we're all moving in the right direction. Obviously, it's a concerning time. Many parents are, making alternate arrangements for children. But we are, as a province, moving in the right direction, given our case numbers, and we want to continue moving in that direction. And, obviously, if you have work in an essential area like healthcare or trucking, you need to continue to go to work, but still be mindful of social distancing, self-monitoring. But otherwise, I think we're all slowing down, hunkering down at home, like the Prime Minister said. And I think that's where we want to be for the next few weeks.
Do you feel the precautions that we've taken already have, because obviously provinces are seeing doubling in cases and not tripling in cases per day, and we've only seen 8 and then increases by 1 or 2 a day.
Yeah.
Do you think that the precautions we're taking are helping us in that transmission, or is it just because we're still such a small population compared to the rest of the country that we haven't seen that big jump yet?
Yeah. So I think there's several ways of looking at it. Even if you look at the U.S., the case numbers increased in California and New York and Washington initially, so bigger populations, more travel internationally. And I think Canada is very similar. Second is, we have been reassured by the fact that travelers, international travelers, have been self-isolating, and it's really important that individuals continue to do that. Having said that, we do expect more people coming back to Canada, with the Prime Minister saying if you're overseas, come back. We expect a lot of people who always come back in March, snowbirds planning to come back from the U.S., and although they may be coming back to familiar surroundings from, their second home in the U.S., I think that self-isolation for 2 weeks is really, really important. Stay at home, monitor your symptoms, get checked if you develop a fever and cough. Don't go to visit your friends, family. Don't go to, large gatherings. That is going to be essential to keep our numbers low. But having said that, community transmission is happening in different parts of the U.S. and Canada, and we certainly need to expect for that and prepare for that. But we feel that as we are slowing down things, we will try to avoid community transmission for as long as we can, or even if there is, we hope it can happen in a setting where there's minimum contacts who were there, and if they were there, if we're all observing social distancing like everyone here is today, if we had a case right now, and as long as we didn't touch surfaces and touch our eyes, nose, mouth, none of us would get exposed or infected. And so that's, I think, it's not a virus that transmits easily as long as we have that social distance. And I think that's what we all need to practice now all the time for the next, several weeks to months.
So are you expecting the cases to double and triple in the days going forward?
We certainly expect, just because we're going to have a higher volume of people coming back, so we certainly expect more travel-related cases over the next week or two. I will not be surprised. We hope we don't see non-travel-related cases, but I won't be surprised if we do. Here, and then there.
On that note, are you still only testing people who have traveled? Because I guess the question many people might have is, if you're not testing anyone who hasn't traveled, how can you prove or be assured that we don't already have community transmission?
That's a really important point. And BC and Ontario have done runs on testing everyone for COVID-19. They really didn't find that useful. We thought about that, but we want to make sure that people who have traveled get tested right away to maintain their self-isolation, because if you develop symptoms on day 10, we want you to get tested, get your result in a day, so you can't come off on day 14. You just have to continue for another couple of weeks. We really want to make sure that people who are providing care, healthcare workers, need to get their test done in a day or two so that they can continue to work if they're asymptomatic or if they have mild symptoms which have settled and they're negative. So we do need to prioritize that, but we are testing anyone who has not traveled who is in the hospital setting. We are testing all outbreaks in long-term care facility which aren't due to another cause. And we are, letting physicians know that, apply your clinical discretion. If someone has attended a conference or a large wedding where there were a lot of people maybe from overseas, large cultural gatherings, other parts of Canada, large, religious gatherings, and asymptomatic, certainly I absolutely agree that we should be testing. But it has to be done with some risk assessment.
Okay. And so on that note, travelers, we've known for a while about travelers from out of country. What about travelers from, say, Alberta and tourist areas particularly? Yeah,
so we get that question asked quite a bit, and what I would say is that, if you've been to another city, especially the provinces with a lot of cases, and if you've been there to a large gathering, a conference, a show, a community event, a wedding, then of course if you come back you should self-monitor. We're not saying self-isolate, but self-monitor very closely and tell your healthcare provider, tell Healthline that you were at a large event where there were maybe people from international settings as well, because in that way your risk would be higher. If you just went to another province and met your immediate family, your risk would really be the same as if you went anywhere in Saskatchewan, as long as your immediate family had not traveled. So I think that's the best advice I would give right now. So I would like to just go around a bit. And
Sorry, I had a question about the website. So on March 12th, when we announced the first case, it said last updated on March 10th, and it had one case. And then today, it says last updated March 15th. I'm not exactly sure when they directed us to the website what we're supposed to be looking at in terms of like the time of day we look, what is specifically being updated, like when the date is going to match the cases. So like, is there a formula you could kind of explain to us and a time of day we should be looking to find these updates?
So I'll actually take that back. Some of the cases are reported after close of business, after 5 p.m. And then we always have to wait till the person who's positive is notified, their clinician is notified. We have to do an initial risk assessment, travel, so forth. So it can be well into the next day before we get that confirmation. And obviously, the clinician has to reconfirm from the lab that yes, it's positive, the case was, all those things. So there is a lag for a few hours, which can go into late into the next day. And I think personally, we need to tell the story, not just the case numbers. It's really important for us to understand that if they're all travel-related with few contacts, that's one thing. If you start seeing cases who have a lot of contacts, meaning that people are not self-isolating, that would be concerning, that someone came back after travel and was not self-isolating. So you, instead of a handful of contacts, which you have now, you could have hundreds of contacts. That would be of great concern, and we'll have to give some public advisory for that, which we haven't had to do so far. So I think we now need to look at it more broadly than just absolute case numbers, and we want to make sure that we have that information before we, so even if we can't announce the case till late the next day, I think we need to get the narrative, which is important for all of us to see where we are in terms of our own risk assessment.
So people, I do think, do want to know kind of an option to follow along. Is there like a time of day or something that we should be expecting?
So I'll take that back, and we'll. So instead of then trying to rush to do it same day, we try to just tie all the loose ends and get better information out in a systematic way. So I'll follow up on that.
You mentioned.
What's the policy right now for visitors to hospitals? And has that changed?
So we do want to decrease all unnecessary visits to hospitals, irrespective if you've traveled or not. We really want to protect our most vulnerable, people in long-term care, people in hospitals. We want to be especially cautious if you've traveled from other provinces, especially where the case numbers are rising. And if you can, don't visit for a couple of weeks, self-monitor. Obviously, if you have to visit for compassionate reasons, don't visit if you have any symptoms. Like if you come from another province, have a cough, but did especially come to visit someone in long-term care, don't go if you have a cough and fever. You may need to wait it out or get tested and confirm that you don't have COVID-19, because that's what we need to avoid. And also within long-term care facilities and hospitals, they are saying, visit only if essential. We're trying to reduce the traffic in those settings because those are high risk for outbreaks, and they have patient populations, elderly people with underlying risk factors that are more at risk. So we are trying to put those principles in place. We always put them during the peak of flu season, but now even though we're coming out of flu season, we're putting those in place for the foreseeable future.
Just to tag on to his question, how does that relate to people coming in emergency situations? Let's say someone's coming there in an ambulance, or someone's going into labor and having a baby, and someone comes later. Does that affect the person coming up to see that person?
Yeah, obviously, we want people to visit for compassionate reasons, but even there, if you have a cough and fever, I think even if you take all the precautions and enter the long-term care facility as a visitor, you could place the whole facility at risk. So I think we just need to take that very seriously.
Well, so the people that show up with that case, they show up with the person in labor, or they show up with the person in the ambulance, they're allowed in, obviously, right? But what about people showing up later? Like, let's say the dad or whatever is still at work, and then they come later in the day. What's the precautions?
I think so. If you're going to visit a close family member, as long as you're asymptomatic, you can visit. If you're symptomatic, you really need to have a discussion with the facility to do a symptom review, and maybe not visit if you have a cough and fever. And I think the implications of exposing not just the person you're visiting, but others could be significant. So that is something that I think we need to take very seriously.
Yeah, just to confirm with you, of all the 8 cases, it's all people who come back from traveling, 6 international and 2 from Canada?
Yes. Of the 8 cases, 5 were due to international travel. 2 were from exposure to a dental conference in Vancouver, and all the conference attendees were notified, monitor yourself for 2 weeks, don't go to work. So that was really good, but they were due to and the one case was a household contact of one of the people who were from Vancouver. No, yeah, same conference. So that's been reported widely in the media. So there's been 2 large conferences, one in Toronto, one in Vancouver, where there have been cases. So that's why actually now we have said no gatherings of more than 50 people if people are coming internationally, because that seems to be a very high risk. We say to everyone, self-isolate for 2 weeks when you come to Canada. It makes no sense for people to come into Canada and go to a large conference. That really is high risk.
Of the one case you said was hospitalized, but you said for unrelated reasons, does that just mean that they're underlying health conditions?
Yes, that's the information we have. And I just want to say that if you look at the total numbers of cases in Canada, 416 now. And I just learned that there's been a second death reported in Ontario, 1 death in BC. We have to understand that it takes several weeks for people, unfortunately, most people do well at home. They clear the virus in a couple of weeks, they're fine. Even people who are older and have risk factors. But if you do require hospitalization, and then unfortunately it can have an adverse outcome. But there's a lag of a few weeks in that. So right now, 2 deaths out of 416 cases is fairly low. But we will see, unfortunately, in a few instances that happening. It hasn't happened in Saskatchewan yet, but that's how a few people do require hospitalization over time and can have serious illnesses.
Right, but for the person who is hospitalized in Saskatchewan right now, it's because they have underlying health conditions, but it is due to COVID?
Well, they have tested positive for COVID-19, but their hospitalization is due to the underlying medical condition. That is the information we have at this point.
Roberta?
We have 2 provinces today declaring states of emergency. Yeah. Obviously, I'm assuming that's on your radar. Is that something that could potentially happen in Saskatchewan? And if so, what's the threshold?
Yeah. So that has been something that has been discussed within government as well. That is discussed on a daily basis within government in Saskatchewan. That is something that we discuss regularly at the FPT table at every level, at my level with chief medical health officers, and also at the ministers and premiers table. At this point, we are able to enact all the steps we need under the powers of the Public Health Act. And actually, even though we're enacting a lot of those things, restrictions on gatherings of more than 50 internationally and more than 250 right now, otherwise, a lot of people are going well beyond that. A lot of businesses voluntarily. It's really, I think, amazing to see how businesses are taking significant personal losses to actually reduce the risk to themselves and their clients. And I think that is leadership by small business owners, by the corporate sector. That is true leadership. And of course, schools, universities universities themselves took the initiative. Schools have also winding down. So I think a lot of things are moving in the right direction. If we needed provisions under the Emergency Act beyond what we have right now, that's still to be considered, and obviously those are enacted when there are massive, forest fires and other things. Right now, we don't feel the need for that, but certainly that would be considered if required.
Should people be canceling weddings, birthday parties, anniversaries?
Yeah, and then we'll come to you, I think. My own personal recommendation is that, this is not the time to have that big indoor gathering. Kids who are home from school, even if you want to have a play date, maybe 1 or 2 people, not 20 people in the basement. I've got lots of calls from friends who were planning to have a wedding or a large event. I'm saying, if I was you, I would cancel. It's not worth the risk, and many people are canceling. I think this is not the time to celebrate together in the way we like celebrating, hugging and all that will come, but this is not the time. But obviously, as we get into spring and summer, outdoors, you can maintain your 2-meter separation. You can do a lot of things outdoors. Indoors, you can do that with, if you have a large gathering with 2-meter separation, as long as you really enforce that and the touch, the discipline not to touch your eyes, nose, face. I think that is really important. And we keep now pointing it out to each other at work or at home that we do it all the time and you have to discipline. But I think if you can avoid large gatherings, it's not worth the risk. And so,
there's a lot of people still wondering in regards to daycares, kind of why they haven't been told to close quite yet, and if that's something that maybe could be happening in the future.
I think we're looking at that closely. I think, like the Premier said, we want to support people who have to go to work, essential services, healthcare, trucking, retail. These are all things that have to stay open. So we need provisions to support people who have to go to work. And at the same time, while the risk is lower in terms of children spreading, we do want to move to the process where you minimize crowding or large groups of any age group. So that is something we need to move, but I think we need to see how that can be done in a way that parents can make alternate arrangements.
On that note, I guess this is kind of twofold. What's the status of talks about providing daycare for essential workers specifically, and also for healthcare workers in general? What's their guidelines for being home? And like, say if you are a nurse, if you have someone at home with who might be vulnerable, what are they being told?
So, we really need to support people who are working at the front line, healthcare workers, others. And in healthcare, because you're looking after people who are sick, who may have COVID-19, the data is showing from other countries that if you use the right precautions, a procedure mask, eye protection, hand washing before and after, you can eliminate virtually any risk of transmission. So in that situation, you are safe to go home to your family. But obviously, you need to monitor yourself constantly in an ongoing way. And at the first sign of symptoms, you need to get screened. Many healthcare workers have been tested. 20% of all tests are actually in healthcare workers now, and they've been negative. So I think that's really positive. That obviously, everyone can get a fever, cough due to a viral illness, and you're screened. So, it's very reassuring that the tests are negative. So I think in that sense, you can go home to your family, but it is of concern, obviously, to everyone, and especially people who are working in the healthcare field.
Vaccines started testing yesterday and today. How, through talking with your colleagues in the medical field, how close is a vaccine? And is there kind of, like you said, most cases will be fine. So is there a lot of push towards finishing a vaccine?
So my understanding is that the vaccine, phase 1 trials for safety have started, but it takes a few weeks to months to complete those. And then efficacy trials takes weeks to months. So vaccines, I think, are more than 8 to 10 months out in terms of showing. I think they would be effective if this is something that would come around every year, like influenza. As you know, when we had the pandemic strain of H1N1, it is really important that when we have the seasonal flu vaccine, it has 3 strains. When the pandemic started in April 2009, we had already a seasonal vaccine ready to go. But then quickly in April, they started making the pandemic vaccine, which was ready by September. And in September, actually, we gave the seasonal vaccine to very few people, but we offered the pandemic vaccine to the vast majority, and it was very effective. It didn't help in the first wave. There were 3 waves in the pandemic. March, in a few countries, it started with pneumonia and hospitalizations. July, we saw a small wave in Saskatchewan. Rest of Canada flew in summer, very unusual. There was no vaccine, but there were antivirals. And then we started seeing the ramp up in October, but then the vaccine came and shut it down. So vaccines can be effective. And then H1N1 is now part of the seasonal strain. The seasonal vaccine now has the H1N1 as every year. So going forward, you get protected every year from what was 10 years ago a pandemic strain. So the vaccine would be effective and useful in the coming years. But at this point, we really can't say much about, will there be vaccine? Will it be available in a year? And will it be used, in an ongoing fashion?
And this might be a stupid question, but people who have got the flu shot this year, is there science saying that they're less susceptible, more susceptible to COVID-19? I don't know.
The science at this time is saying that this is not a drift of the influenza strain. When we get an influenza pandemic, so every year the flu virus shifts, but if it drifts, it's an influenza pandemic. This has nothing to do with the influenza strain. So the flu vaccine is really good because you don't get influenza, but it doesn't help against coronaviruses. So
the 8th case, have you been following up on their contacts?
Yes.
Were they self-isolating immediately?
Yes, I think public health is following up with contacts. So far, all the links are being made with contacts, so that's very reassuring. The concern would always be if someone had not traveled, and the concern would always be if someone had not self-isolated while symptomatic and had had a lot of contacts while ill. And that's why even if you haven't been anywhere, if you get a fever, cough, stay home. You're not going to school or university anyways. Don't go to work. Don't go to large gatherings if you fever, cough, because then even if you develop COVID-19, you have not exposed a lot of people. And that is essential to keep. Even if we saw community transmission, it's essential to keep our clusters small for as long as we can.
If someone is self-isolating and showing symptoms, what do they do to get tested then?
So if someone is self-isolating, if you haven't traveled, if it's mild symptoms, you can watch. You can go to the online algorithm. They'll say if you haven't traveled right now, it's saying, watch your symptoms. But obviously, if the symptoms are worsening, fever, cough, shortness of breath, you should see your healthcare provider. You should call ahead and tell them, I have not traveled, but I have gone to a large gathering or haven't gone. Under these circumstances, you'll probably be asked to wear a mask when you go to see your healthcare provider. You're probably seen in a side room. We don't want people with coughs and fevers sitting in a waiting area. And if your healthcare provider thinks that you should get tested, you may be sent to an assessment site. So, if your symptoms are getting worse, you may be assessed to go for testing, and especially if you need in-hospital care. But in any case, any symptoms of fever, cough, we always say don't go to school, work, don't go out. Now is especially the time to be especially mindful for that. So,
here
and then
sorry.
there.
You can go first.
Okay. A lot of families, particularly, seem to be highly anxious. So you mentioned the case of, say, play dates with kids who are being home and are bored and are isolated themselves and probably worried. 1 to 2 people, as long as you know their travel history, is that okay? Should they stay away from playgrounds? I guess, what is your personal recommendation for families and kids?
Yeah, so certainly, with my own youngest son who's now unhappy because he's missing his grade 8 graduation, I did tell him that, children in Japan graduated together on Minecraft, as an example. And he did mention that can he have 1 or 2 friends only? And I said, talk to them or let the parents have a discussion about, did you travel? Are you fine? I think we need to be very cautious, minimizing contact and having the minimum contact. But we do need to interact socially, either in person with 2 meter separation, but smaller gatherings, making sure that we are all fine, not symptomatic. And I think we just need to see how comfortable we are with a few close friends who everyone is comfortable that they are not symptomatic. But we need to minimize a lot of social mixing. And if it's just 2 or 3 friends getting together, as long as they're symptomatic, that is at least a manageable group. That's the best I can say. Obviously, once the weather changes, or even now, if you want to go out for a walk or a run, I think that's fine. But even when you're out and about, playgrounds and those things, that we have to teach our kids also that avoiding that, once you come back, wash your hands really well. And if you're out and about wearing gloves, not wearing gloves, avoid that, touching a surface and touching your eyes, nose, throat. I think that is really important.
Your toddler chew their gloves, but other than that,
toddlers, I think you have to monitor. Toddlers, you just have to monitor. It is challenging. I think outdoors, as far as I know, it's a less risky environment, but you can't guarantee anything. But but even outdoors, avoiding that crowded setting.
Like an isolated playground with, like people are concerned about services, obviously.
Right. I think there's a high degree of concern from people who are part of essential or pseudo-essential services who might have compromised immunity or who might have, be at a higher risk because of their age or underlying health conditions. Are there going to be precautions or discussions around how we can protect these people who may need to step away from their employment for their own well-being?
Yeah, I mean, I don't have any. I'm not aware of any specific policies. I think in healthcare and other settings, we do want everyone to observe the same precautions. But you're right, if you're older, if you have underlying risk factors, even there, the vast majority don't, have a mild illness, but the proportion who can get a more severe illness is higher. So certainly in a non-work setting, it's especially important for people who are older, who have underlying risk factors, to avoid large gatherings. But now it's important for all of us because we don't want to get sick and then transmit to others. But I know what you're saying, that in healthcare and other settings, if you're older, have underlying risk factors, should you have any additional accommodations that, a person who's otherwise healthy, younger, is going to work in the retail sector, someone who's older has underlying risk factors may have some accommodations. I really can't speak to how employers can accommodate people with, a high risk. I think that's a good point, and I think certainly that's something that all employers need to start thinking about. But at the same time, sometimes it is challenging if you are within a small group of essential workers. But I think all of us need to practice the same precautions and keep our risk as low as you can.
Especially thinking about people who might be, not even making as much money as a healthcare worker, like you mentioned, grocery store workers, or people who are, on those front lines, but they're not going to have that employment protection, but they are extremely high risk. Like, what are they in anyone's mind right now? How
I think that's
how are we going to get them out of the
I think that's a really important point, and I know that at the federal level there's been some announcements by the Prime Minister, and so I'll just make a note of that and see if at a provincial level we have any further comments on that.
There's been a lot of media that said that this virus is driven by people who are asymptomatic, just going out and about in public, and it's been the case with a lot of celebrities that have been diagnosed with the virus, that they say that they're not experiencing symptoms and they feel fine, but they've only been tested out of precaution, like NBA players and stuff like that. So why is there still a stress to test only people who are symptomatic when it could be those asymptomatic people carrying it around?
So the data I've seen is that, and that's why the 2-week home isolation is so important. You're home isolating while you're asymptomatic because there is data that says that even when you have mild symptoms, a slight cough, a slight achiness, you can transmit. So we want you to be home when you develop symptoms. Even if you're at work, and we just had this discussion with the workplace, they were just asking advice. So if you're at work, you start to feel achy and have a chill, normally you'd work till the end of the day, and then you'll see how things are at the evening and maybe call in sick the next day or drag yourself to work the next day if it's just a cough and not a high fever. Now is the time. You're at work, you develop a bit of achiness, stand up, clean your surface, go home. Then let your manager know that you had an achiness, you were sick. Watch how it is for a day or two if you haven't traveled. I think that's really important because as far as I know, they've done serial swabs on people, for example, who were on cruise ships. You do have mild symptoms when you start shedding. You could have swabs done which will be positive, but the risk really is once you start developing symptoms. But that's absolutely right, and that's why the 2-week home isolation is essential. Otherwise, you could have just said self-monitor, but the self-isolation for 2 weeks is an added layer of protection just because of that.
And then just to follow up on Roberta's question, Communications and Health just indicated that in terms of the posting, it said that daily posting of surveillance results will always state the previous day. So there's a cutoff at the end of the day, and so yesterday's results.
So they post it at end of day every day? Like, I'm just trying to see when.
No, so they don't have a specific time, but the current results, like whatever's being done today, you wouldn't have today's results until tomorrow.
Yeah, I
So they're-
understand. I'm just saying when, like if so
Yeah.
people are checking
Like
or
3 p.m. or 4 p.m. the next day.
They're updating as fast as they can, but there isn't a specific look.
We'll
at
get some details, but I think it's safer to just wait a bit till we have the right information.
Of course, yeah.
And I just personally feel that as case numbers climb, the numbers actually are less important. Is is it travel related? Is it community transmission? I think that becomes really important for us to understand and then also convey. So.
Thank you, Dr. Shah.
Thanks, everybody.